Now, for many years, aesthetic medicine has evolved through the development of new procedures, technologies, and products. Today, however, we're witnessing a deeper transformation. Concepts such as skin longevity, regenerative medicine, personalization, and tissue quality are redefining how we understand the skin health and aging. The question is no longer simply how to correct visible imperfections. The question is how to preserve and support the biological function of the skin over time. To explore this evolution, we have brought together two complementary perspectives: advanced formulation science, regenerative treatment protocols, and real-world clinical practice. Together, we will discuss how the future of skin medicine may be shaped by a more integrated and biologically driven approach. Thank you so much. If you both had to identify one concept that is currently redefining modern aesthetic medicine, what would it be and why? Dr. Foz?
Thank you so much for having me.
Prego.
I believe that, in my opinion, as we already said during this Congress since morning, the most, or let's say fundamental thing that should be changed is aesthetic medicine, focusing on biology of the cells, regeneration and longevity, rather than just filling up and focusing on what is wrong, what we are seeing on the scan or only on the surface. So this is my opinion, that we should focusing on it for the next years.
Exactly right.
Thank you.
And for many years, Tatiana, the industry focused on the concept of anti-aging. Today, we increasingly speak about skin longevity. What fundamentally distinguishes these two approaches?
Sure. So looking more at the root cause of the issue, when we understand the root cause, we can much more appropriately identify a solution. I will go a little bit more specific with skincare. Whereas in anti-aging, we addressed collagen synthesis, more elastin synthesis, which is more difficult to do, as we know, moisturization. We had vitamin C, AHAs. This was anti-aging. Now, with identifying some of the root causes and the testing we have available, so we're looking at helping the mitochondria produce more ATP. Our energy declines with age. We all have probably felt that at one point. So our fibroblasts, our keratinocytes, our melanocytes, they don't have as much energy to regenerate. We have lots of different ingredients, lots of procedures. The limiting factor is energy. So recently, Revision Skincare working on technology that actually helps the mitochondria produce more energy. And not only that, we are not affecting the mitochondrial health, we're improving it, looking at the mitochondrial membrane potential. So actually improving the health of the mitochondria while producing more energy. Another example is the dermal-epidermal junction. So we all talk about collagens 1 and 3, we talk about elastin. What about the rare proteins at the dermal-epidermal junction? That's very, very crucial for communication and skin adhesion. The laminins, fibronectin, collagen 4, collagen 7. These are proteins that we didn't pay attention to with anti-aging. Much more attention. Revision feels the dermal-epidermal junction is even the longevity layer of the skin. Very, very important. So some differences there.
Thank you so much, Tatiana. Dr. Foz, in your daily clinical practice, what is the most significant shift you're observing in patient expectations and treatment goals?
So today we are here, we have so many scientists, but I'm seeing myself as a doctor, I'm an end user.
Exactly.
So in past, let's say, more than 5 years, the aesthetic industry changing or shifting from using only fillers and Botox, or maybe peeling or devices, to more regenerative and healthy looking skin, rather than filling up pillow faces and the disaster that we used to see, I'm sorry, 2 decades ago. So this, which is also, especially because I'm coming from the region that I believe I'm coming from Middle East. And in Middle East, basically, there are most of the end users, especially for filler and Botox, they are in the Middle East. But also in Middle East, we are seeing a drop of using, let's say, HA, and instead, also the patients focusing on using biostimulators, exosomes, peptide, and focusing on the healthy skin rather than before.
Thank you, Dr. Faz. And Tatiana, we now have a much deeper understanding of chronic inflammation, oxidative stress, and skin barrier dysfunction. How are these biological mechanisms influencing the development of next-generation medical skincare strategies?
Yes, very, very influential, very fundamental and influential. A little bit of inflammation is good, right? We have procedures, we have a little bit of inflammation, we have a wound healing regenerative effect, but the low level simmering inflammation, very detrimental. So from a skincare perspective, one side effect of that is many more free radicals are released. So we have very specific antioxidant blends. Antioxidants always work best in blends. Different free radicals, different structures, different affinities. We have different antioxidants. And so also, a colleague earlier mentioning this, that also helping the skin to stimulate more of its own synthesis of antioxidants. Revision has identified a blend, this is patent pending, that actually helps the cells produce more of its own glutathione, a master antioxidant, producing more. So that is a very strong side effect of inflammation, but it really affects the balance of the health of the body in whole. A dysbiosis very much affects the diversity and balance of the microorganisms. We're gonna, I believe, the microorganisms on the skin, the bacteria, the balance, that is a frontier that we have just touched the tip of the iceberg. More to come, and inflammation affects that very strongly as well. So we always have to balance that.
Thank you, Tatiana. And Dr. Faz, when designing a treatment plan, is it more important to address the visible imperfections or to improve the underlying biological quality of the tissue?
I think by now everybody knows the answer. Of course, it's more important to focus on the biology of the tissues and also regeneration of what we have instead of just masking the problem.
Exactly.
As I already said, there is a high claim for using exosomes, peptides, creams, and biostimulators rather than the other HA filler as it used to be before.
Thank you so much.
Thank you.
Tatiana, we're living in the era of hero ingredients, peptides, growth factors, exosomes, and other emerging technologies. How important is the individual ingredient compared with the overall therapeutic strategy behind a formulation?
Yes, so the innovation taking place in skincare is very, very exciting. We have a team, we call it a lean, mean team. There's just, we don't have a huge department, but we have a very passionate team, and very much focus on this. In fact, the launch we are working on right now is for 2031. So innovation into the future. And it is very important. I feel human nature, consumers, patients can best grasp a simple message of a simple technology. but very much the delivery on the skin, and then the compatibility. I have seen very early in my skincare career, being a formulation chemist and working on different formulations, I have seen clinical studies conducted on skincare products that actually age the skin. It is not a given that a skincare product on the market is beneficial. Most are, but it's the fine difference between great technology and a great product, the best product, disruptive innovation, and true visible results is that delivery system.
Absolutely right. And Dr. Foz, today physicians have access to an unprecedented range of treatment options: advanced skincare, chemical peels, biostimulation, energy-based devices, and other regenerative therapies. What is the greatest challenge in creating truly personalized treatment plans with all of those options?
I know, it's very confusing. It is confusing, especially for the doctors. I think choosing the right patient for the right device, for the right product, and directing the right problem and solving the problem individually is the most important. So, as we already said through the day today, that it's not one recipe for all. In my clinic, I don't cook. But in my clinic, I'm thinking as a patient, it's like making a good cook or a good lunch. So for each patient, you need different type of product, different device, and different, for sure, program.
Exactly. Unique treatment plans for every
For
patient.
sure, individually.
Exactly. And Tatiana, will the future of aesthetic medicine be defined by increased